I was asked to do a day in the life video of what I go through in a day in the spine surgery office. So I actually don't have any more patients left today, and I've been studying different things about the heart because pretty soon I will be moving on to a new job in heart failure. So spine will be no longer, at least for now, even though I've enjoyed it. But anyway, so to get started, I will show you what I go through. So obviously for privacy reasons, I'm not going to log in, but first thing I do is I log into my computer charting program, my EMR, and I see what's on the list today. Usually I will look the day before in case there's something that I'm not familiar with, and I'll, kind of do a little bit of a study before I come into work the next day. But that's what I do first thing. And then as the patients come in, as I come in, the MAs get the patient ready, and so then obviously I look at their chart. So the chart's usually in here. I look at the chart before I come in, and then I come in and I greet the patient. So this is the patient room, one of them, and of course it has a station for me to work at, the bed for the patient, or a table, whatever you want to call it. We always have a reflex hammer, a sink of course. But first thing I do is introduce myself, and then I log into the computer to get a note started. So while I'm sitting here, I'm engaging in short conversation with the patient, and I'm noticing things. Because this is spine, I'm noticing how are they sitting, are they grimacing, what's their facial expression like. If I've watched them walk, sometimes they'll get up from the chair and get on the table. I've watched them walk. If I haven't watched them walk, I will tell them to walk so that I can see. And then, so I'm doing a lot of assessment just in conversation. But once I'm done with the conversation, I've gotten some history of their present illness, and I've started my note, go through all of the subjective data first, then I do my exam. Once the exam is done, then I do my treatment plan, and then I come out to tell the MA who is checking the patient out what the treatment plan is going to be for that patient, and then they get them started on whatever they need to have done. Now, if the patient has seen the surgeon and he's determined that they need surgery, then they come into another office. This is the surgeon's office, but the office is next door, but she's in there, and I told her I wouldn't get her in the video, but they go talk to her, and she asks them questions, gives them a date of the next surgery opening, and they go from there with insurance and all that good stuff. But pretty much that's the workflow. My workflow is basically what I said. I log on to my computer in the morning, look at the patient list, and as the MAs check them in, I do my assessment and exam and treatment plan, and then I come back to my office and do that over and over again. And I really, really like it. Of course, my next job is going to be quite a bit different because it's an educator role as well as treatment role. I'm not exactly sure because I haven't done it yet, but anyway, so that's what it's like in this particular spine surgeon's office anyway. So I hope this was helpful. I'll talk to you later. Bye.